Circumcision, according to the book Human Sexuality Diversity in Contemporary America, states that circumcision is the surgical removal of the foreskin which covers the flan's penis. Circumcision is fairly common for newborn boys in certain parts of the world, including the United States. Circumcision is done usually after the newborn period if possible, but it's a more complex procedure. For some families, circumcision is a religious ritual. Circumcision can also be a matter of family tradition, personal hygiene, or preventive health care. For others, however, circumcision seems unnecessary or disfiguring. After circumcision, it isn't generally possible to recreate the appearance of an uncircumcised penis. The American Academy of Pediatrics, or AAP, says the benefits of circumcision outweighs the risk. However, the AAP doesn't recommend routine circumcision for all male newborns. The AAP leaves the circumcision decision up to the parents and supports use of anesthetics for infants who have the procedure. Circumcision might have various health benefits, including easier hygiene. Circumcision might make it simpler to wash the penis. Washing beneath the foreskin of an uncircumcised penis is generally easier, however. Decreased risk of urinary tract infection. The overall risk of urinary tract infection in males is low, but these infections are more common in uncircumcised males. Severe infections early in life can lead to kidney problems later on. Decreased risk of sexually transmitted infections. Circumcised men might have a lower risk of certain sexually transmitted infections, including HIV. Still, safe sex practices remain essential. Prevention of penile problems. Occasionally, the foreskin of an uncircumcised penis can be difficult or impossible to retract. This can lead to inflammation of the foreskin or head of the penis. And lastly, decreased risk of penile cancer. Although cancer of the penis is rare, it's less common in circumcised men. In addition, cervical cancer is less common in the female sexual partners of circumcised men. Circumcision might not be an option if certain blood clotting disorders are present. In addition, circumcision might not be appropriate for premature babies who still require medical care in the hospital nursery. Circumcision doesn't affect fertility, nor is circumcision generally thought to enhance or detract the sexual pleasure for men or their partners. Female genital mutilation, also known as female genital cutting, and the female circumcision, is a ritual removal of some or of all the external female genitalia. Female circumcision means piercing, cutting, removing, or even sewing closed all or part of a girl's or woman's external genitals for no medical reason. But FGC has no health benefits and can cause long-term health problems. The 4 types of FGC are Type 1, partial or total removal of the clitoris. This is also called clitoridorectomy. Type 2, partial or total removal of the clitoris and the labia, the inner and outer lips that surround the vagina. Type 3, sewing the labia together to make the vaginal opening smaller. This is called infibulation. The clitoris may be left in place. And Type 4, all other harm to the female genitalia for non-medical purposes, including pricking, piercing, cutting, scraping, and burning. FGC is done mostly in parts of northern and central Africa, in the southern Sahara, and in the middle parts of Middle East and Asia. Different communities and cultures have different reasons for practicing FGC. The reasons are often complex and can change over time. Social acceptability is the most common reason. Families often feel pressure to have their daughter cut so she is accepted by their community. Other reasons may include to help ensure a woman remains a virgin until marriage, hygiene. Some communities believe that the external female genitals that are cut are unclean. Rite of passage. In some countries, FGC is part of the ritual that a girl goes through to be considered a woman. Condition of marriage. In some countries, a girl or woman is cut in order to be suitable for marriage. Belief that FGC increases sexual pleasures for the man. Religious duties, although no religion holy text requires FGC.